Hello and welcome to another episode of Health Show with Amara. I'm Dr. Amara Sohail and I'm back with another very important health related topic. Today's topic is about infections in winters, mainly the chest infections. And to discuss that, we have invited in our studios today Dr. Nadeem Sajjad Raja, who is an NHS microbiology consultant, and also with his non-clinical roles, he's a general secretary of APNE, which is the largest organization of Pakistani doctors in Northern Europe. Let's welcome Dr. Nadeem Sajjad Raja. Hello, Dr. Raja. Thank you very much for your time to come to our studios to discuss this very important health-related topic.
Thank you very much, Dr. Amara Sohail, for having me over here and to discuss such an important topic today, because it's very important. The flu infections or respiratory tract infections or other viral infections start appearing during autumn.
So is it true that the number of patients attending any health facility is rising up significantly? Do you see that in the hospitals these days?
Certainly, you are right. Also media reports, and this is my personal experience. My co-workers, my colleagues also told me that nowadays we see a rise in the respiratory tract infections, because not only bacteria, also viruses, they are more active during this season. They proliferate. This is their favorable environment and weather. So, and then they infect not only healthy individuals, but also people who are living with some underlying infections. So we receive a lot of request laboratory tests for identification of the causative agents of respiratory tract illness in our lab.
Okay, and you said various respiratory tract illnesses. Could you tell our viewers what are the commonest illnesses that you come across in day-to-day life, in winter especially?
There is a wide range of respiratory tract illnesses, because these infections start from the nose and throat and reach up to the base of the lung. So a variety of infections. It could be a very common cold, and common cold, as we know, that it's a very unpleasant, and it causes severe pneumonia. These or microorganisms cause severe pneumonia, and sometimes this infection could be fatal. So there is a wide range.
So we see influenza, flu, or common cold, as well as COVID, most importantly. So how do you distinguish between various types of infections?
When any patient presents with signs and symptoms of respiratory tract illness to either general practitioner, or they arrive to the hospital emergency. So on the basis of sign and symptoms, it's very difficult to distinguish what is the causative agent, but the experts or doctors who are working in emergency department or our general practitioners, so they can make a guess whether it is a viral infection, or because it again depends on certain signs and symptoms, or could it be a bacterial. So after taking a careful history, then they order a battery of tests.
What tests are available on NHS or otherwise?
So all sort of tests are available, from bedside to the specialized laboratories for specialized tests. So for example, we can check whether this patient is suffering with any COVID or something, influenza or any other virus at bedside. That is called as point of care testing. Otherwise, they take swab from nose and throat, and sometimes they take phlegm, sputum, and they send to the microbiology lab for further testing. So we have specialized tests we have a latest modern molecular tests. We identify the causative agent or microorganism which is causing respiratory tract illness, and then we inform, or the lab results arrive to the requesting clinician, and then they start treatment. But in most of the cases, they have already, on the basis of their clinical judgment and their medical background knowledge or their experience, they start empirical treatment. So empirical treatment means that we know that, for example, this is our guess that patient is suffering with influenza virus infection or COVID, or Streptococcus group A or Staphylococcus aureus infection. Then according to that, our guess, so we start treatment. So once we receive the result, then we start definitive treatment according to the causative agent or any organism which is causing infection.
And these tests, they're available at GP surgeries as well, because of course we all know that during winter season, GP surgeries are overwhelmed with the number of patients requesting for consultations because of the viral illnesses. Do they have these tests available there as well?
Certainly. So rapid tests are available, so they do, and they tell quickly. And if these tests are, for example, not helpful, because there is no test which could tell us 100% that this is the organism which is causing infection, then they take relevant specimen and they send away to the microbiology lab, and then microbiology lab, they do different types of tests, and they provide the result to GP or doctors in the hospital.
Yeah. And do you think it is important for any patient or any young children's parents to bring these children to any healthcare facility for testing, or should they stay at home? What is your advice to these parents as well as people who suffer from these infections?
It really depends, parents, or if someone is adult, so they should think very carefully. It depends on the severity of illness and whether that patient is a healthy person or if person is living with some underlying illness or any problem, for example, different types of diseases. If patient is healthy, signs symptoms are not very severe, so they should phone telephonic consultation, either 111 or they phone to their GP surgery, and then take their advice. After the discussion, they will advise accordingly. If person is suffering with severe illness, then they should seek medical help as quickly as possible. Especially my message for those patients who are living with underlying illness, because this disease, respiratory tract illness, could be severe, or in some cases could be, the outcome could be unwanted or undesired.
Yeah, I mean, it makes sense, but generally the public should be aware of the fact that most of these illnesses, they don't necessarily need any therapies or treatments. So, because, I mean, you would agree that a lot of times, especially for young children, parents, they think that antibiotics is a very important treatment for their, for them. So, do you think antibiotics are necessary for any chest infection patients have?
Antibiotics, no doubt, have a very important role in preventing bacterial infections. Unfortunately, antibiotics are ineffective against viruses because these are designed to kill bacteria, not virus. My message to parents of young children, please always seek advice from your doctor. If antibiotics are necessary, for example, there is a super added bacterial infection to viral infection, then definitely they will prescribe. If not necessary, so please don't insist, because inappropriate use of antibiotics, organisms, bacteria are exposed to antibiotics, and then bacteria develop resistance. And that's why nowadays commonly used antibiotics are becoming resistant and unable to kill the organisms. So please always follow the advice of your doctor.
And so that clearly is a message that antibiotics may cause more harm than good.
Exactly.
And most of these winter infections, they could be viral and they don't need treatment with antibiotics.
Exactly.
So should parents or people who are suffering from these illnesses, is there a time scale you tell them, especially if their symptoms are not too severe? Should they be looking for getting better, a time limit on when they would start getting better, especially if it is a viral illness? Is there a time scale you tell them?
There are so many viruses circulating in the community at the moment. Majority of the viruses, even influenza virus or COVID virus, they do not cause severe illness. So usually they cause like a cold-like symptoms. In most of the cases, people don't need really hospitalization or they don't need to consult. So again, they should be vigilant. If like in a few days time, if the signs and symptoms are not disappearing or they don't feel better, then they should seek medical help and they should discuss with their GP or dial 111. And for those people, they should be really very vigilant who are living with some health problems.
Right. And why is it that winters actually causes more of such infections? Why is it weather related?
Because during winter or cold weather, majority of people, they live in a closed circuit, like in offices, or they sit together in one room. So that is one of the important reason, the close contact, and the distance between different people is reduced. During winter time, there are not a frequent air changes in the room. So that is the reason that the number of microorganisms or for example viruses circulating in the room, so their number go up when we talk, when we sneeze. These are the common things. That's why we see more respiratory tract infections during cold weather.
So Dr. Sajjad, you just mentioned that people who have any underlying illnesses, they should be more careful. Would you tell our viewers who are these people who could be more vulnerable to acquiring this kind of infections?
There are certain groups of patients or people who are at risk of developing severe disease. For example, extreme ages. If any child who is less than 6 months old, or any person or patient who is more than 65 years old, people who have kidney problems, who have renal problems, or who are living with heart problems, some like diabetes. Diabetes is also important risk factor, or someone, their immune system or body defense system is not strong. For example, if someone is living with cancer, either due to blood cancer or any body organ cancer, so they are at risk of developing severe disease, these group of people.
Yeah, so they should seek advice sooner rather than later.
Exactly.
Because things can progress very quickly. So as you rightly said that in winters people stay indoors and there isn't a good circulation of air within the room. So what is your advice to people? What precautions should they take, or what are the good measures they should adopt when they think that they may be having some kind of viral or any bacterial infection, apart from seeking advice from medical professionals?
So person who is suffering with respiratory tract illness, so first of all they should inform their close contacts. Please, I'm suffering with illness because these infections are contagious, spread from one person to the other person. They should isolate themselves, like stay away from the others, seek medical help if required, plenty of fluids, rest, and stay away from other people. In other words, we can say isolate, because we don't know what is the causative agent. And they should take respiratory precautions. For example, if they are sneezing, so they should cover their nose and mouth with the tissue paper, and then discard tissue paper into the bin, wash hands frequently. And also one very important thing I like to mention, that many of us, they actually do this thing. They should not sneeze on their hands, because whenever they will touch any surface, so organisms will transfer to that surface. Or if they shake hand with any person, so the organisms will be transmitted to the new person. So in the same way, the person who are living in close contact of the patient who is suffering with respiratory tract illness, they should also take precautions, stay away from the person, or there should be at least more than 6 feet distance among them. Both patient, if necessary, they should wear mask. And people who are at risk of developing infection, they should take specifically these precautions, mask, and we will talk later when we will talk about the prevention, so what they should do. And also frequent changes, air changes in the room.
Yeah, that's very good. So you mentioned about avoidance of close contact, but of course, like for young patients, it's very difficult for parents to avoid this close contact. So, and you mentioned about the use of masks in situations like that, yes, because they can easily be a source of spreading this infection elsewhere with their other siblings and all that. Now, I mean, we have lived with COVID for so many years now, and COVID has basically changed the face of the world big time. Do you think COVID is back?
COVID has been circulating, COVID or coronavirus. COVID is the name given during the pandemic. So coronavirus is circulating since centuries. So we see, even before that, we see mild infections with this coronavirus, and we still see infections due to coronavirus. But nowadays, coronavirus is not as virulent as it was during the COVID time or pandemic time. Nowadays, this new strain is very transmissible, and that's why we see a lot of infections, but most of the infections are mild to moderate, and sometimes this coronavirus infection goes unnoticed really.
Yeah, I mean, like you mentioned, coronavirus has been there for centuries, and but the severity of the illness that we saw in the last 2-3 years, we never experienced that before. So why do you think that those were the bad times, and now even if people are having COVID, it's not as severe? What do you think is the reason why this infection is not as bad?
These organisms or viruses, they have ability. So they can make changes in their structure, and sometimes they come up with a new type. So during COVID time, so that is also called as, in a scientific term, mutation. And nowadays everybody understands what mutation is. So this is actually ability to make changes in their structure, in their proteins. So before the pandemic, a new type of COVID came up, and that was very virulent, and it had a capability of causing severe infection, respiratory tract, and not only respiratory tract, but other body parts. So that is the reason. So now they have, again, these coronaviruses, they have made changes in their structure. So that's why nowadays we don't see any more very severe or fatal infections like we had experienced during pandemic time.
Yeah. And do you think vaccination has got something to do with now developing these milder symptoms? Do you think it has got a role?
Vaccination is a very good invention of science, not only to prevent disease but also to minimize the sign and symptoms of the infection, because some people still suffer with infection, but their sign and symptoms are not severe, as for example if anyone hasn't received any vaccine. That is true. So it is very useful in most of the cases. So we should receive a vaccine, because these, as I mentioned earlier, that these infections are unpleasant and they affect our day-to-day life, our work, our routine work, and also if someone is suffering with infection, so family members are also uneasy. So that's why vaccine is the very good, and it minimizes infection.
Yeah, I mean, you would agree that even though vaccination saved so many lives all over the world, but we still hear controversies about the side effects or impact of vaccine on people's body functionality. And I mean, you would have also come across situations where people are reluctant, especially in my practice. I see a lot of pregnant women, they are very skeptical about receiving the COVID vaccination, and even these flu vaccinations, they are very reluctant because they think it can cause harm. What would you say to them?
Not only it's my opinion, but it's proven that these vaccines carry more benefits than harm. These vaccines, after so many hard work of researchers, a lot of funding from government, so these vaccines are launched after careful studies, examining of all the data they have collected, and if more beneficial, then government approves these benefits, these vaccines. So no doubt there are some side effects, but it's not that everyone will experience those side effects. Maybe a few percent. These vaccines are more beneficial, save more lives, because we have seen during COVID time, before the introduction of this vaccine, we have seen people were slipping away from the hands of the medics. But after the introduction of vaccine, we see good effects. People were suffering with the illness, but that was mild to moderate, not as severe as it was before the vaccine. And again, it is not suitable for everyone. So they can discuss with their doctor. So doctor would advise them accordingly. If, for example, it is not suitable, because some people are allergic to any ingredient in the vaccine, so they shouldn't receive. But there are so many theories. It is my opinion that please follow the advice of your doctor, and it is more beneficial if it is suitable. It is more beneficial than harmful.
No, I agree. And with the, of course, vaccination is important, and as you have just mentioned, it's life-saving. What are the other precautions or advice you would give to people to avoid the areas with close contact, but other precautions in terms of nutrition, their own health, or whatever you think is beneficial for our general public to reduce or minimize their risk?
Always stay healthy, do exercise, eat healthy food, stay happy. So these are the things. Regular exercise really help to boost the immune system. There are several foods which are helpful in boosting immune system, because if our immune system or our defense system of our body that is strong, so because our defense system fight with the with the organisms, bacteria and viruses. So in this way, we can fight with the infections, and our body can fight with the infections.
Yeah, so that's an excellent advice, that instead of treating the illness, prevention is the most important thing. So, and vaccination, people who are scared of having vaccine because of the potential risks to their health, I think it is very important to live healthy, but to live without worrying about the side effects, because it's been, as you've just said, that it's been tested, and there is a general consensus that it causes more good than harm. So thank you very much, Dr. Raja. That has been very useful.
One more thing, sorry, I want to add. By receiving a vaccine, not only we protect ourselves, but we also protect our loved ones, especially those who are living with some health issues or health problems, and we also protect our friends. So that is my message. Sorry. Yes,
no, thank
please.
you. And also for the healthcare professionals, of course, winters is coming, and already we have seen a lot of staff shortage in various fields of healthcare. What is your advice for the healthcare workers when they have any illness? Should they be staying at home? Because, of course, if too many people are staying at home, who is going to look after the patients who are admitted in the hospitals? So what is your advice to them, especially?
No doubt, as you mentioned, healthcare workers, their role is very important. Their health is very important. So once they suffer with any respiratory tract illness, the vaccination uptake rate is very, very good, especially in the last 3-4 years. So majority of our health workers, they go for vaccination, whichever vaccine is available. So if they are suffering with any respiratory tract illness, they should speak with occupational health. They should seek advice from their line manager, and they should contact with whoever is available, their own general practitioner, because we also need to, we are concerned about their health, and also we are concerned about our patients' health. So they should seek help. If they are advised to stay away until the disappearance of signs and symptoms, they should stay at home and not to come to the work. So they should always seek help and discuss with line manager, occupational health, as well as their GP.
Thank you very much, Dr. Raja. Very, very informative and very useful information you've given to our viewers. So one last and final message to our viewers about the summary of what you have said to them.
Remember, respiratory tract infections are unpleasant. These infections interfere your daily or routine work. The best way to prevent these infections is vaccinate yourself. So you should contact your doctor today and discuss about vaccines, receive vaccine, for example, influenza, COVID vaccine. So to protect yourself, to protect your loved ones, and protect your extended family and friends. Thank you very much.
Thank you very much, Dr. Raja. That has been a very useful session. Thank you. So viewers, we hope that you have benefited from this very insightful conversation with Dr. Raja, and hopefully you would come forward and have yourself vaccinated when you receive a call from your GP or elsewhere. So goodbye for now. I'll be back with another health show next week.